Good afternoon, everybody. Welcome to Dental Voice with Zyris. My name is Rolando Mia. Today, we have a very special guest, and I'm especially excited to hear from Dr. Robert Rosenthal. The purpose of Dental Voice is to hear from professionals and experts in our industry and basically have them share insights, perspective, experience, and then give us advice. Dr. Rosenthal has been in practice many years now, but he brings to us today experience from a completely different place, insurance. Dr. Rosenthal used to be the president of an insurance company in North Carolina, and I'll let him share that with you. And what he is going to cover here is a lot of information about what very few people know and how dental insurance companies actually use the information, claims data, and that kind of information basically to do that. So, good afternoon, and thank you, Dr. Rosenthal. Thank you so much for coming. How are you, sir?
I am well. Thank you for inviting me. It's been a pleasure working with you and Zyris. It's been a awfully amazing event. It's kind of crazy. We went to Zyris. We went to Isolites. My staff won't go back.
Ah,
Um, they love it. Patients are so happy about it. Um, some of them were a little reluctant, but once they had it, they said this is the best dental experience they've ever had. So we're not going back.
well,
Why?
thank you.
Yeah.
No. Thank you for that, and I appreciate that. What I'm really interested in is you sharing with us how and what insurance companies does. So, if you could give us a little background on your experience, and then we could get into what do they do and how much do they really know about their constituents.
So way back when, I was on the board of directors of Delta Dental of North Carolina. Upon the death of the CEO, I became basically in charge of the company, to which point they gave me an offer I couldn't refuse, and I became the CEO, president, and chairman of the board of Delta Dental of North Carolina. By becoming that, I also went on the board of directors of Delta Dental USA.
Oh, wow.
By doing that, I learned about the dental insurance business and I left private practice. I soon learned about dental insurance and profiling of dentists. And I'm here to explain to you that the dental insurance companies know more about the dentist than the dentists think they know. What I learned was dentists could be profiled from A to F, and that profile will follow them and how they're treated based on their submission of claims. So the claims data and the analytics of the claim data will create a profile, and that profile will make it easier or more difficult to get your claims approved by the insurance companies.
So, wait a minute. So, it's not everyone is not treated the same?
I believe everyone is treated the same. However, if you are an A dentist and you do things following the insurance company's program and you submit everything appropriately, that claim may go through. However, if you're an F dentist, they may ask for more information, and that claim may be backed up 2 or 3 times asking for more information.
So wait a minute. How do they determine an A dentist versus an F dentist or whatever in between? What's the how,
So there are algorithms that determine the profile of the dentist. Those profiles are guarded secrets that the insurance companies and the analytic companies will keep because that's their business. I mean,
right?
it only makes sense that it's proprietary. However, an example would be If every time a dentist does a crown, the tooth needs a root canal, that isn't good for the patients. If every extraction with the tooth not having any bone around it is a surgical extraction, which requires more money, the insurance company is not going to be too happy. The problem for the dentist is the insurance companies are bound by contract and overseen by the insurance commissioners that they are appropriately distributing the money that they collect. So
Huh.
while the dentist might think that they went to a lecture and the lecturer tells them the secret sauce of how to make more money, the insurance companies have already heard about the secret sauce and they're aware of these routines to increase revenue. And it's inappropriate based on the fact that you're trying to just generate income as opposed to treating the patient appropriately.
So wait, based on the claims and how claims are being submitted, the insurance companies can actually determine fraud?
Fraud can be determined by, are you doing what you said you did? Are
Right.
you billing for things that you didn't do? Are you billing for more than you said you did? Are you submitting for multiple surfaces when those surfaces don't exist? So, all those factors, the number one fraud is to increase the surfaces of the restoration just because you know that the two-dimensional x-ray doesn't show the three-dimensional tooth.
Ah, so they can tell, or there's enough information in there to do that. I mean, it's interesting with the fact that, and we hear this so often now, Dr. Bob, that you know right now dental insurance payouts are decreasing, but rates are increasing. So, how is this affecting what insurance companies are seeing clinicians or practices do with regard to those claims?
It's a very interesting problem. At the American Association of Dental Consultants meeting, one of the representatives for an analytic company, which is a company that reviews claims and looks at the analytics of those claims, made the statement that if you increase the amount of discount, the amount of fraud, abuse, and waste increases. And
Huh.
what he was basically saying was if a dentist doesn't get paid a fair income or a fair reimbursement for the amount of work they do, the dentist will determine an aggressive method to compensate for that restoration. For example, let's say you did a crown,
Right.
and a crown is normally in my area $1,500. If the insurance company says we're only going to pay you $800, you have a problem. That's about half the
Right.
income. We know that dental overhead is usually about 66%. And if you're only getting 50%, that restoration cost you 16%. So then the dentist adds a buildup, be it if it's necessary or not, a 4212, which is dental code for extension of the tissue to get underneath the tissue. They may say they did crown extension, so that $1,500 crown may be $2,250, $2,500 in order to increase the revenue to cover the $1,500 crown. And the insurance companies are aware of that. Um, the problem is people need to be compensated so that they make an honest living. And if the insurance companies decrease the reimbursement, it makes it more difficult for the dentist to be able to practice and pay his bills and pay his staff. In my own case, I've had insurance companies where it actually has cost me money,
To
or reimbursement was lower than my cost of delivering the service. And in that case, I had to get out of the network. There's just no way I can run my office to compensate. Now, some people believe that I should charge more money to the patients that can afford to pay for my dentistry, but that's not fair to them. And
yeah.
I can't rationalize increasing my fees to cover the cost that insurances won't pay. And I'm
So
not against insurance companies. I've worked in them. President-elect of the American Association of Dental Consultants. My problem is the dentists need to understand that they're not working in a vacuum, that people are watching what they do, people are watching what they submit for, and they need to be aware of that, that it's not a vacuum. And if they're not careful, they can wind up in a very bad place um, with their profile.
So it sounds like when people try to get more reimbursement by adding things, which is effectively fraud, it doesn't just affect that, it affects everybody because now it's compromising the system. But it's also, I guess, flagging certain people, and then rates get adjusted. So in other words, insurance companies know pretty much what you're doing pretty quickly. Is that what I'm hearing?
Sure, the insurance companies and the analytic companies can actually follow lecturers throughout the United States. And what the dentists don't realize is if they go to a lecture of 100 dentists, all 100 dentists hear the same information
Yeah, they write it
of
down.
secret sauce. And then they take the secret sauce and they apply it on Monday morning. And all the dentists in that area are now changing their mode of submission of claims. So you can theoretically, and the insurance companies, and I've been told that they can actually watch different lecturers following through the countryside as they go from place to place lecturing with the secret sauce.
Wow. So, all right. So with all that, knowing that they're monitoring, knowing that they know, knowing that it's very easy for them to kind of track what's going on. What advice or what should dentists do as it relates to insurance? Go fee for service, or and you mentioned insurance isn't bad. So, what would you suggest
Well,
that they do?
the first thing is do what you say and say what you do. Don't bill for things outside of what you're really doing. You learn the proper things in dental school and just apply that. Now, the frustration comes in when you do the right thing and you're not being compensated.
Right. Right.
So, the second thing is there's always the ability to appeal. And most of the time, I will do peer to peer and I try to understand what the dentist is telling me and go from there. The the important thing to realize is the insurance companies have a fiduciary obligation with the insurance commissioners to do the right thing.
Yeah.
If every crown you do has to have a buildup, that's not necessarily true. If every patient you see needs a comprehensive examination every time they walk in the door, that ain't going to help. So you got to look at what the CDT book is and apply it to what you do. And the other thing is, you may hear a lecture, you may hear the secret sauce. Take it as a grain of salt, see how it affects your practice, and don't take it as always the most appropriate thing for you and your practice. because it can run into problems, and the problems can be very detrimental to you in the future. So
How, I'm sorry, sir. How, I'm curious, when you say problems, what are some examples, or do people actually get caught and get in trouble? Or
I've unfortunately I've been a expert witness for a dental complaint. Luckily, I was not asked to testify, and I say that lightly, but the dentist submitted something to Medicaid that every time the patient walked in the door, they had a comprehensive exam. When they spreadsheet him, he had $100,000 or more of complaint of these fees, when the closest person to him may have been $1 or $2,000. He stuck out as a sore thumb, and he got in trouble. He wound up spending 6 months in jail and having his license removed. So
okay,
the the problem is, you just can't do and think nobody's watching you. They are watching you. They do want to do what is right. It doesn't mean that you can't make a good living being a dentist, but you need to realize that you can't just do what somebody tells you they got away with. You
ah,
need to look at what you do for yourself and see if that's what you're comfortable with.
so I love it. Do what you say and do what you do. Don't try to compensate, and if you need to, you can appeal. It sounds like.
True.
And then the third one, or if you were to say the most important thing in working with, you know, um, what would that be?
Is remember the things you were taught and apply them to how you treat your patients. You can make a very nice living, and but you don't have to take advantage of people. You can make a very nice living. Patients will appreciate your honesty, and you can have less stress in having a great practice.
It's kind of it's encouraging because of all the bad mouthing that insurance companies are getting. That to hear, especially coming from there, that insurance companies want to do well, and it's when when people try to take advantage that kind of all kind of falls apart. Do
Mhm.
what you say what you do. Don't try to expand beyond that. It's important. I think it's also important to realize, and this is something I took away, Dr. Rosenthal. They can tell very easily and very quickly exactly who's doing what. Now, it's interesting, the comment about how come this doctor, Dr. Rolando, is doing 10 times or submitting 10 times the amount as everyone else in his area. That's a flag. So they can see
Right,
that. And I've been getting away with it, or not getting away with it. I felt that it was okay. I'm not saying there's malice, but this is, I'm just trying to recoup some of my costs, but
right,
they can see that. So that's
right.
really interesting to know.
So if you take all the dentists in America, there's going to be a norm. There's going to be a ratio of how many fillings you do to crowns, how many extractions you do to impacted teeth, how many root canals need to be done per crown. And if you're outside of those parameters, you're suspect. Now,
Right.
obviously, if you're a root canal specialist, you're going to do more root canals than a general dentist. In the olden days, that used to be a red flag, but the insurance companies got smart, and the analytic companies now know who's a root canal specialist, who's a general dentist, who's an oral surgeon. So that myth is gone.
Right.
They
Right.
know, and if you're a root canal specialist, how many root canals you do and how many need to be retreated and how many of those teeth need to be extracted are all right there to be seen.
So the statistics will say how close you are to that. And when
Right.
you're way out, that's when they know immediately, uh-oh, something's going on here.
Right.
That is so awesome. Oh my goodness. Dr. Rosenthal, first of all, I really appreciate you taking the time. It's interesting. Insurance is kind of the bane of a lot of dialogue and a lot of frustration. Hopefully this kind of clarifies a couple of things for people, and that, it's reassuring to know that I guess they will listen, and you can do that. If people wanted to reach out to you and ask you or just have questions about it, what would be the best way to contact you for additional questions?
Well, there's two ways. One way, the easiest way, is my email, which is Robert Rosenthal, DDS, RobertRosenthal, DDS, at gmail.com. I get a lot of emails, not as many as when I was the head of Delta Dental, but I get a lot. I will get back to you. You can call my office, but chances are my staff will um,
Protect you.
protect. I have enough problems just trying to take care of my patient load. Um, or you can get up with Rolando here and he'll get up with me,
Oh,
and
there.
I'll be
Be happy to do
more than happy to help whoever I can,
that.
however I can. It may not be immediate, but I will do my best.
And then you mentioned too that you're part of a consultancy group. What is that group, sir?
I work for P&R Dental Strategies, who are an analytic company that review claims. We have about over 100 claims reviewers, and they've been very kind to me, very good to me. I do peer-to-peer. I'm on a IT committee, quality assurance committee. They've been very nice, and I've learned a lot about dental claims from them. Um, I also have worked for other companies reviewing claims for them. I'm not doing that now. I also work with the North Carolina Dental Society. I'm chair of the Dental Benefits Advisory Committee, and that's the group where we are giving our dentists who have asked what their profiles are, and we're working with P&R Dental Strategies. We have a combined group, and we're trying to teach the dentists what the appropriate techniques are, what the insurance companies are looking for. You take an hour or an hour and a half video, and if you do the right thing, after a year, you can get your profile changed. This is the only program where you can change your profile. And if the profiles are going to be used to determine reimbursement, this is an obviously good program for you to be in.
I love that. So people can, so I'm taking this away, and correct me if I'm wrong, can actually affect the profile that they have by understanding how to ensure that they're doing the right thing.
Correct.
Fantastic. Oh, that is fantastic. Dr. Rosenthal, thank you so much for joining us. Thank you for taking the time. I'm really excited about the, hopefully people are getting some insights. Please, those of you who are watching this, if you have questions for Dr. Bob or want to understand kind of what you're going through, please feel free to reach out to him. The experience you've had being both a clinician, having your own practice, as well as working with dental insurance company is huge. And I think you can shed some really clear light and kind of reassure people how to get through it, as opposed to just kind of going through that. So thank you so much for that. Happy Thanksgiving. Hope things are well. Big shout out to Dr. Mark Hyman says hi. He says you're
Mark's
awesome.
a good friend. He's a good friend.
That's, which is good, and it's great to see that. But really appreciate it, and thank you so much for that. Have a great Thanksgiving. Looking forward to maybe following up with you at another time. Sound good?
That sounds good. Thank you so much for inviting me. Really enjoyed it.
Thank you, sir. Appreciate it. Take care, everybody.